Andrea, thank you. According to the Centers for Disease Control, 1 out of 3 adults over 65 falls every year. Slip and falls are becoming more and more common as our population ages. So today, we're on your side, making sure that does not happen to you, does not happen to your grandmother, does not happen to your father. And we're so excited today that we have Dr. Carmel Turner from Palmetto Health. Good to see you. Okay, so I guess the first thing that we need to do when it comes to avoiding a slip and fall is just getting the basic stuff out of the way.
Right. Well, clutter on floors and such. Oh,
yeah.
well, of course.
Yeah.
Most houses are littered with many things, but wires across the rugs and rugs that are curled up, the little frilly edges, rugs in the bathroom and in the entryway that are not tacked down, that can slide. Of course, animals, little pets.
I remember going to my grandmother's house and she had a throw rug everywhere. And I'm sure my grandma's not the only one. There are a lot of grandmothers out there, and you go in, you're like, Nana, Granny, Grandma, move this rug, you're going to trip and fall on it. And they don't listen to us because we're the grandkids or we're the kids. But they may listen to you guys at Palmetto Health because you all actually have a slip and fall prevention program.
Yes, we do. We have a fall prevention program, and it's been up and running for several years now. And when people, elderly typically, when they go to the doctor after a fall or even prior to a fall, and say, maybe I've been unsteady on my feet, and the doctor sends them to Palmetto Health with a prescription for fall prevention, and we would put them through a battery of tests, check their balance, check their strength, check their range of motion, and devise a program for them specifically designed to help prevent them falling, and also give a lot of education to the patient and the family for the same things that we just spoke about.
So you guys actually go to the house and say, this needs to be moved, that needs to be moved?
We don't.
Okay. But you give all the education that they need in the office
We do,
visit.
and ask a lot of questions about, even though we say, is there clutter on the floors or things like that, and they may say no, we'll say, well, is there a clear path to your bedroom, and can expand on it, and sometimes some things come out.
That makes a lot of sense. Okay, well, the oldest guy I can find today. The oldest guy I can find today is J.R. Berry. So he has volunteered to be our slip and fall, our stunt double, our slip and fall participant. Now, Dr. Turner told me during the commercial break, before we became on the air, that the best thing to do is work on exercises that will help you not fall in the first place.
Correct.
So J.R. is going to do these exercises, even though we know you're like 26 years old and you don't need to do this kind of thing, but help the people, J.R., by sitting in the chair and going through the exercises with Dr. Turner. So what do we do?
Well, actually, we'll start, of course, after they've gone through the evaluation, we know their safety level. And of course, you shouldn't do this at home unless you've already been evaluated by a physical therapist. Right. And some of the exercises may not be safe.
Oh, okay.
So I brought my belt just in case JR decides he wants to be unsteady on his feet. So let me hook him up.
Okay.
Now
I'm going to move out the way so you can hook JR up.
You hooking me up?
I am hooking you up. Now, we will give a home program to the patients, and they will do some of their exercises at home, but only when and if they are safe to do so.
Okay.
A lot of times, the family needs to help. They wouldn't be in fall prevention if they were safe to do these things at home. So usually we'll say when we first start out that you need to hold on to something stable. This chair is a good, demonstration. Although the chair can move, I recommend maybe the countertop or something like this. And of course, it would be, he's so tall.
Yeah.
And one of the first exercises, maybe kicking out to the side, kick out that way so you don't kick me. There you go.
Yeah.
Yeah, out and back.
Okay, back in, JR.
No, out and in, and out and in.
Yeah.
And it takes, for the elderly, it takes quite a bit of instruction, you can see.
Yes.
Okay.
Okay.
And then another one is kicking straight back. And also tippy toes and heels. And tippy toes and heels. See, the chair is already moving. This isn't a stable object. You should be on the countertop or your dresser.
Okay.
And even if you are safe and stable to do these at home, if you're sent to the fall prevention program, make sure that a family member is there with you to assist you in these exercises. I'm holding him. He doesn't really need it. He's athletic as, more
He's
athletic.
A golfer.
Okay.
He's a golfer. So
and another thing would be standing on one leg, and I am right up here. I'm holding on. And you can let go at this time. In therapy, we have them do these things hands-free because we're working on that balance.
That makes sense.
And then back up a little bit.
Okay.
And we can also do tandem stance.
Okay, this is great. Dr. Turner, I wish we had the rest of the newscast to go through this because I really just like watching JR do certain things. But we're out of time. Give us that number one more time for folks at home who want to call and take the first steps to make sure they don't fall.
I wish you hadn't asked me the phone.
Not the phone number.
I just have a direct line.
I think we have that
Oh,
number.
296-5486, that would be us.
There you go. All right, so stay with us. We're going to send JR back to the information center to work on the 6, and we've got more Friends at 5 coming up now that we know he won't fall. Coming up after the break.